Today, I'm going to talk to you about a condition called familial hypercholesterolemia. This is a condition where one is born with excessively high levels of cholesterol. We're not just talking about slightly elevated, but we're talking about massive elevation in the cholesterol when they're born. We're talking about cholesterol levels in the 5 or 600 and bad cholesterol levels of close to 1,000. So a normal cholesterol in general is cholesterol less than 200. Ideally, should be even less, 150 or so. But the total cholesterol above 200 is considered high cholesterol. These people genetically have extremely high cholesterol. So whereas a normal cholesterol should be less than 200, these people's cholesterol goes up to 5 or 600. And their bad cholesterol, their LDL, their low density lipoprotein, their LDL level that normally should be around 100, theirs is closer to 1,000. So their bad cholesterol is about 5 to 10 times more than what it should be. And this is in childhood, at birth, or 5 or 10 or 15 years old. So I had a patient last week that came to see me as a new patient. 38-year-old man who was diagnosed with familial hyperlipidemia or familial hypercholesterolemia at the age of 12. His cholesterol was so high that the doctors started him on a cholesterol medication, statin, that he had been taking since the age of 12. So I did some testing on him and I found out that he's doing okay. He had a little bit of plaque buildup in the arteries of his heart, which was minor, but given his age, that was a lot of plaque. He should not have any, at that age, at the age of 38, he should not have had any plaque buildup. But he had been treated for this condition, familial hypercholesterolemia, since the age of 12. His cousin, however, who is currently 28 years old, did not get treated. And he also had extremely high cholesterol since childhood. At the age of 26, his cousin, his first cousin, developed 2 heart attacks and ended up getting 8 stents, and now he's being evaluated at the age of 28 for open heart surgery. This condition is serious. If you please make sure you check your cholesterol levels. If your cholesterol is very high, you have to be on medications under the care of your cardiologist, and the dose of the medication or the type of medication needs to be adjusted to prevent this condition. Now, the cousin of my patient, thank God he's doing okay, he's alive, and with medical treatment, he should be fine. But again, I think he's one of the youngest patients that I know with this condition that has had a heart attack already in his mid 20s. So remember, young people can get heart attacks. Young people can get heart failure. So be proactive, see your doctor, see your cardiologist. Prevention is the key.